Welcome back! In today's video, we're going to be talking about Escitalopram or Lexapro and comparing it to Vortioxetine or Trintellix. And this is in response to one of our viewers who asked us to make a video specifically about this topic. If you would like us to make a video for you, drop it down in the comment section below and that video will be coming your way. So in this comparison, we're going to specifically look at how these two medications work, what they're used for, their common side effects, some considerations to think about, and my final thoughts. So without further ado, here we go! So first of all, let's talk about how these two medications work. So with Vortioxetine, this is a multimodal antidepressant. And now both of these medications are antidepressants, but since Vortioxetine has many actions on various serotonin receptor sites and transport systems, it's going to lead to increases in not only serotonin, but also norepinephrine, dopamine, glutamate, acetylcholine, and histamine. And this is why Vortioxetine boasts pro-cognitive effects. Escitalopram, on the other hand, is a pure SSRI. It goes in there and targets that serotonin transport system and will just specifically increase serotonin levels. And so what are these medications used for? Lexapro or Escitalopram was FDA approved in 2002 for the treatment of major depressive disorder in ages 12 and older and generalized anxiety disorder. Vortioxetine or Trintellix, on the other hand, was FDA approved in 2013 for the treatment of major depressive disorder in adults. Now, Vortioxetine can be used off-label to treat generalized anxiety disorder and also used adjunctively or with other antidepressants to specifically target those cognitive symptoms of depression. It's also commonly used in geriatric depression because geriatric depression will commonly have those cognitive symptoms that come with depression, like poor memory, poor concentration. Now, Lexapro or Escitalopram also has off-label uses that include panic disorder, post-traumatic stress disorder, social anxiety disorder, and premenstrual dysphoric disorder. Therapeutic doses of both Lexapro or Escitalopram and Vortioxetine and Trintellix are 10 to 20 milligrams. Now, when we're looking at the common side effects, with Vortioxetine, you'll have nausea, diarrhea, dry mouth, and dizziness. And then with Escitalopram or Lexapro, you'll have headaches, nausea, somnolence or insomnia, and dry mouth. Now, when it comes to the side effects, remember that both of these medications are typically well tolerated, and these side effects, if you're going to experience them, will typically disappear once your body adjusts to the medication in about 1 to 2 weeks. So if you're experiencing any of these side effects, hang in there and they will typically go away within that adjustment period. Now, many of you are concerned about weight gain, and I get it, but both of these medications are considered weight neutral. However, the way that some of these medications can increase your weight is by increasing your cravings for food and increasing your appetite. So to minimize that, like I always say, you want to make sure that you only keep low-calorie snacks and foods on hand so that when those cravings come about, you'll be reaching for lower-calorie options like fruits and vegetables, and therefore not so much impact on the weight. Now, when it comes to sexual dysfunction, there are reports of sexual dysfunction for both of these medications, just like there are for many of the antidepressants out there. With Escitalopram, you've got 2 to 12% of males reporting this, and about 3% of females. With Vortioxetine, according to the FDA label, reports in males were 16 to 29% and females were 22 to 34%. And these numbers sound very high. And what I found interesting is that in the male group, 14% of the placebo group also reported sexual dysfunction. In the female group, 20% of the placebo arm also reported sexual dysfunction. So for some reason, this group of patients, perhaps it was psychological, but the placebo arm and the medication arm both had reported high rates of sexual dysfunction. However, I do not see this in practice. And in researching this a little bit further, I found an article from 2015 that was a comparison study comparing both escitalopram and vortioxetine for antidepressant-induced sexual dysfunction. So these patients were on other antidepressants that cause sexual dysfunction, and then they were switched to either escitalopram or vortioxetine. And in that study, vortioxetine was superior in treating that antidepressant sexual dysfunction, which is what I see in practice. If I have somebody that has sexual dysfunction with another antidepressant and I switch them to vortioxetine, it typically is resolved. Now, some considerations here with both of these medications. Like all of the antidepressants, there are rare and dangerous side effects to these medications that I cover in this video. So if you haven't seen that video yet, go ahead and check it out. It's a thorough review of the first-line treatments for major depressive disorder. And also with drug interactions with these two medications, keep in mind that they are antidepressants, and when they're acting on serotonin, that there's a risk for bleeding, and you increase that risk when you add non-steroidal anti-inflammatories like ibuprofen and or other blood thinners. That risk of bleeding will be increased. Also, there's a risk of serotonin syndrome, and that risk is increased when you take other medications that can increase serotonin. So watch this video if you haven't already so that you can get a good understanding of serotonin syndrome and which medications are the most likely to put you at risk for serotonin syndrome. Now, with drug interactions with escitalopram specifically, there really aren't many drug interactions here because escitalopram is not an inhibitor or inducer of any of the CYP enzymes, and it's metabolized by two different pathways. It's metabolized by the CYP3A4 and the CYP2C19. And because it has these two different pathways, even if it's paired with an inhibitor or an inducer of that pathway, it has been shown to not have much of effect on the metabolism of that medication. When you're looking at vortioxetine is primarily metabolized by the CYP2D6. And so if you're taking any medications that are strong inhibitors or inducers of that enzyme substrate, then you are going to be at risk for some drug interactions and may need to increase or decrease the dose of vortioxetine. Now, it's important that with either of these medications, despite the risks here, you always want to make sure that you're putting your medications into a drug interaction checker and looking to see what the risks are with the medications that you're taking and making sure that the medications that you're taking are safe to take together. Also, make sure that you are letting all of your providers know all the medications that you're taking, including over-the-counter medications. And so to wrap this up, my final thoughts on Vortioxetine or Trintellix and Escitalopram and Lexapro are this. So both of these medications have a lot of efficacy and proof that they work. They're both great at treating depression and even anxiety, and both tend to be very well tolerated. However, in a 2016 study that indirectly compared many antidepressants, including Vortioxetine and Escitalopram, Vortioxetine was actually the most tolerated medication over escitalopram and a lot of these other antidepressants, and that was noted by a decreased or very significantly low dropout rate due to adverse effects. Vortioxetine is also superior in treating patients who have those cognitive symptoms of depression, who have decreased concentration and poor memory due to depression. Vortioxetine is going to be superior in treating those patients with that specific symptom. Now, in my opinion, Escitalopram is superior in treating generalized anxiety disorder and other anxiety disorders like panic disorder when compared to Vortioxetine. And Vortioxetine seems to be superior in treating depression with an underlying mix of anxiety. When depression dominates and anxiety is underlying symptom, Vortioxetine tends to be superior in treating that type of depression. And this is just something I see in my clinical practice. However, the big disadvantage of Vortioxetine is right now is that it is not generic. It is still branded under the name Trintellix, and so therefore it's very expensive. It's like $400 to $500, and that's with like coupons. So if you have insurance, right now insurances are typically covering Vortioxetine if you failed another antidepressant first. Then you can go ahead with Vortioxetine, and they should, or most insurances should, cover it without any cost. Now, if you don't have insurance, there is a patient assistance program that can help you to get that cost down significantly. And I'll make sure to link that patient assistance program down in the description. And you can go ahead and go on that site, click on where the application is. So that way you can go ahead, apply, and hopefully get a discount if you feel that Vortioxetine or Trintellix would be a good choice for you. However, keep in mind that when you're choosing which medication is going to be right for you, it's going to be different for everybody. There are many factors and variables here that determine whether or not a medication is going to work for you. This video just goes over the generalized information that's out there about these two medications and comparing that. So the best medication for you is going to be the medication that you can tolerate and that treats your target symptoms. So there's my review on Vortioxetine or Trintellix and Escitalopram or Lexapro. Do you have anything to add to this video? Have you taken Trintellix or Lexapro in the past and want to share your experience? Go ahead and put that down in the comment section below, because we learn from sharing each other's experiences. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.